students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. In this lecture 8, I am going to cover appetite suppressants, digestants and carbonatives. Okay, without any further delay, we will dive into the lecture. So, what are the appetite suppressants? What are the appetite suppressants? Appetite suppressants are the drugs which will decreases the appetite. So, in which condition you can use the appetite suppressants? Those who have to reduce their weight, those who are taking over consumption of food, in such a condition you can give the appetite suppressants. So, in previous class we had discussed about the appetite stimulants. What are the appetite stimulants? Appetite stimulants are the drugs which will stimulate the appetite. Appetite suppressants are the drugs which will suppress the appetite. So, appetite suppressants are also called as anorectic agents. Anorectic agents. So, what these drugs you can call as appetite suppressants are called as anorectic agents. The anorectic agents are the drugs which will reduces the appetite, or it will decreases the lowering of food consumption. Though any person have to reduce their weight, in such a condition you can give these drugs, but these drugs are not preferred for a long therapy. If of these drugs has been if your administration has been stopped, again you will increase your weight. So, here you can see the such conditions, the neuropeptide affecting energy balance. So, there are some neuropeptide affecting energy balance. You can see here by this energy balance, there are some drugs which can increases the food intake. There are some drugs which can inhibit the food intake. Let me discuss which drugs will increases the food intake and which drugs will decreases the food intake. Okay, the first one is the increases in food intake. So, these are the drugs which will increases the food intake, like a non-adrenaline, neuropeptide Y, opioids, cannabinoids. So, these are the drugs. So, if you are talking about the cannabinoids which I had discussed in the previous lecture, because it is an appetite stimulant. Opioids, it is also an appetite stimulant. So, these are the drugs which will increases the food intake. So, if you are taking of these drugs, it will increases the food intake. So, which drugs will inhibit the food intake? 5-hydroxytryptamine, this also which I had discussed in your previous lecture. 5-hydroxytryptamine, it is a serotogenic neurons which is responsible to decrease the appetite. Apart from 5-hydroxytryptamine, dopamine also will inhibit the food intake. Glucagon like peptide. So, these are the drugs which will inhibit the food intake. So, this is the classification falls under of appetite suppressants. If I am talking about these appetite suppressants, what are the drugs comes under here? Adrenergic agents, serotogenic agents, agents acting on both adrenergic and serotogenic, and cannabinoid receptor antagonists. So, in this classification, which type of classification it is? What type of classification it is? It is any appetite suppressants. So, what are the drugs you can use as an appetite suppressants? So, here there are a lot of drugs you can use it to treat the appetite, which you can treat decrease of food consumption. You can use it to treat the you can use it as an appetite suppressant drug. So, what are the drugs here? Adrenergic agents. Okay, adrenergic agents are one of the category falls under appetite suppressant. Second one is serotogenic agents. Serotogenic agents are also drugs which falls under appetite suppressants. And third one is agents acting on both adrenergic and 5-HT system. So, there are some drugs which will act on your both system to decrease the appetite. And last one, cannabinoid antagonist drugs. So, cannabinoids, when cannabinoid bind to its receptor, it will promote the stimulation of appetite. So, by blocking of this receptor, it will decreases the appetite, right. So, these are the 4 drugs which you can use as an appetite suppressants. What are the appetite suppressants here? Adrenergic agents, serotogenic agents, both adrenergic and serotogenic agents, and cannabinoid receptor antagonist drugs. So, appetite suppressants. So, appetite suppressants are the drugs which can causes the anorexia. There are some drugs. If I am before going to the appetite suppressants, let me see, there are some of the drugs which can causes the anorexia. What is an anorexia? Loss of appetite. First we learn to understand what are the drugs will decreases the appetite. Okay. So, if you see here, there are some drugs which causes the anorexia. What is anorexia? Anorexia is called as a loss of appetite. So, these are the drugs drugs. There are some drugs which causes the anorexia. So, let me see what are the drugs will causes the anorexia. First one is antimicrobial drugs. Okay, first one is antimicrobial drugs. In antimicrobial drugs, you can see the metronidazole, fluoroquinolines, okay, erythromycin. So, these are all the antimicrobial, these are the antibiotic drugs. Okay, antimicrobial drugs are the drugs which will decreases the appetite. Next one, aminophylline. Which type of drug it is? Aminophylline is an methylxanthine drug which is used to treat the bronchial asthma, or which will reduces the bronchial spasm. You can use it to treat the reduction of to reduce the bronchial spasm. Aminophylline, this is such a drug which will causes the anorexia. Next one, anti-malarials. Anti-malarial are the drugs which are used to treat the malaria. So, by taking of these anti-malarial drugs, it can causes the reduction of appetite. It will decreases the appetite. It can produces the anorexia. Metformin, what type of drug it is? Metformin is an anti-diabetic drug. For which to which purpose you are using this drug? To decreases the glucose level in the blood. To decrease the glucose in the level, to treat the diabetic patient, you will take the metformin. It is an anti-diabetic drug. When you are taken the metformin, it will decreases the appetite. It can produces the anorexia. Let me see about the another drug, digitalis. Digitalis, which type of drug it is? It is an cardiac drug. Which cardiac disorder you can use it to treat by giving of digitalis? You can use this digitalis, can use it in the congestive heart failure. So, if you are taking the digitalis to treat the congestive heart failure in a particular patient, it will cause the anorexia. So, this is the drug which will reduces the appetite. Okay, levodopa, what is the drug it is? Levodopa is a prodrug which is used to treat the Parkinsonism disorder. It is an anti-Parkinsonism drug. This drug is also will causes the anorexia. Okay, so there is such a list of any drugs which can induces the anorexia or which can produces the anorexia. So, what are the drugs which can produces the anorexia? Antimicrobial drugs, antimicrobial metronidazole, fluoroquinolines, erythromycin, all these drugs will decreases the appetite. And after that, aminophylline, digitalis, levodopa, anti-malarial drugs, metformin. So, all these are the drugs which will decreases the appetite. Next, limitation of the anorexiants. So, what are the limitation of these appetite stimulants? Short efficacy, short term efficacy, you cannot use for a long term. Okay, by using of this long term can produces the toxicity. Okay, so you should not use the appetite suppressant drugs for a long term therapy. If you are advising or if you are prescribing the drugs from the doctor for a long time therapy, it can produces the toxicity. So, these are the suppressants which are used to decrease the weight. So, when you are stopping this drug, again reversion of weight gain will be seen. This is the major drawback of the appetite suppressant drugs. Next, we will move to the digestants. So, what is mean by digestants? Digestants are the drugs which will increases the or which will promote the digestion. So, when you will give the digestion, if any particular person will not able to digest his food or her food in a particular condition, you will prefer to give the digestants. So, what the digestant drugs will do? Digestant drugs will act on a GIT and it will improve the digestion of any food. So, what are the digestants you can use here? Pepsin. Pepsin is a digestant, right? Renin is also a digestant. Pancreatin is also a digestant. Bile and bile acids, okay, and quinodeoxycholic acid, urisodeoxycholic acid. The quinodeoxycholic acid was be replaced by urisodeoxychloride. Now, the quinodeoxycholic acid is not using very much because it will increases the LDL levels. This quinodeoxycholic acid will increases LDL levels. So, what is mean by LDL? It will increases the LDL levels, the cholesterol levels, low density lipoprotein levels. Okay. So, this due to because of this reason, this drug will be replaced by the urisodeoxycholic acid. It is an form, it is an analog to the quinodeoxycholic acid. So, these are the drugs which are used as an digestants. What are the drugs you can use as an digestants? Pepsin, renin, pancreatin, bile and bile acids, quinodeoxycholic acid, urisodeoxycholic acid. These are the drugs which falls under digestants. So, these are the drugs which will improve the digestion, right. So, we will discuss one by one here. Pepsin. pepsin. So, pepsin it is a proteolytic enzyme. What is a pepsin? Pepsin is a proteolytic enzyme which is obtained from the stomach of hog. So, from where this proteolytic enzyme pepsin has been obtained? Pepsin is a proteolytic enzyme. From where it has been obtained? It has been obtained from the stomach of hog. So, it is administered orally in the dose of 0.5 to 1 mg. So, whenever you are suggesting to give the pepsin as a digestant drug, you can give 0.5 to 1 mg of this drug by oral route. By orally you can administer the pepsin to 0.5 to 1 gram. Another enzyme like papain, which is present in papaya, it is also used as a proteolytic enzyme. It is also a proteolytic enzyme, okay, which is also helpful. This is an enzyme papain. There is one more enzyme papain which is present in papaya. This also will increases the digestion. It will improve the digestion. Okay. So, we had discussed about the pepsin, and second one is renin. Renin, this is partially purified milk curdling enzyme. So, mainly it is obtained from the calf's stomach. So, from where it has been obtained? This renin has been obtained from the calf's stomach. So, if you see the uses of this renin, it is used in the preparation of cheese. So, cheese preparation, in the cheese preparation you can use the renin. So, renin is also a digestant. There is also a digestant, it will increase, it will promote the digestion. So, it will obtain from the, so this is the partially purified milk curdling enzyme. Renin is also an enzyme which is obtained from the calf's stomach. Okay. And next one, pancreatin. Pancreatin is obtained from the hog or ox pancreas. Pancreatin. So, pancreatin is an enzyme which is present in the, which is obtained from the hog or ox pancreas. So, ox pancreas and hog pancreas, from this pancreas you had obtained the pancreatin, okay, and it consists of enzymes. What type of enzymes it consists? Amylase, tryptase and lipase. These are the three enzymes which this contains the three enzymes like amylase, trypsin and lipase. From where the pancreatin has been obtained? Pancreatin has been obtained from the hog or ox pancreas. It is obtained from the pancreas of hog or ox. So, it consists of mainly three enzymes. So, what are the main three enzymes here? Amylase, trypsin, lipase. Okay. It is administered orally in enteric coated capsules. So, why it is administered orally in enteric coated tablets? To prevent the gastric inactivation. To prevent the gastric inactivation, these are the drugs administered orally in the form of enteric coated capsules. In the form of enteric coated capsules, these are the drugs has been administered. These drugs are employed and replaced therapy in the chronic pancreatitis. So, if any particular person having the chronic pancreatitis, this can be employed and replaced therapy can be used. Okay, the pancreatin is an enzyme which consists of an amylase, trypsin and lipase, which has been administered orally in a coated form to prevent the gastric inactivation. Okay, it has been employed as a replacement therapy in chronic patients or chronic pancreatic condition. Next one is the digestion. We will see about the bile and bile acids. So, bile and bile acids normally 1000 ml of bile will be secreted by the liver per day. How much ml of bile will be secreted by the liver? 1000 ml of bile will be secreted from the liver, and this bile will this consists of this liver it consists of bile acid, cholesterol and bilirubin. Normally it will get, if you are seeing about the bile and bile acids, normally 1000 ml of bile will be secreted by the liver. From where the bile will be get secreted? The bile will be secreted from the liver. How much ml of bile will be secreted? 1000 ml of bile will be secreted. It consists of bile acids. What it consists? It consists of bile acids, cholesterol and bilirubin. So, it consists of bile acid, cholesterol and bilirubin. The bile acids are important in emulsifying the fats in intestine. So, what is the important role of these bile acids? What is the importance here? Why we have to take the digestants? The digestants are important in emulsifying the fats. So, these are the drugs which will emulsify, the bile acids are the drugs which will emulsify the fats in the intestine. This is the important role of bile acids. Okay. Next one, quinodeoxycholic acid and ursodeoxycholic acid. Quinodeoxycholic acid in shortly you can call it as CDCA. What is mean by CDCA? C represent keno, D represent deoxy, C represent cholic, A represent acid. Keno-deoxycholic acid, and this is called as an ursodeoxycholic acid, UDCA, okay, UDCA, ursodeoxycholic acid. So, this keno-deoxycholic acid can causes the diarrhea. So, if you are taking this keno-deoxycholic acid, it can causes the diarrhea, it can increases the LDL levels in the stomach, but the hepatotoxicity was very rare. This is not any major side effects with this keno-deoxycholic acid. This is not a major side effect like hepatotoxicity, but it will increases the LDL levels and it causes the diarrhea. So, this drug will be, so this is the reason this drug has been replaced with the uridoxycholic acid. Okay, it is an analog of CDCA. Okay. So, what are the pharmacokinetics of any digestants? So, digestants are the drugs which are absorbed orally. Digestants are not absorbed, they act locally in the GIT and excreted in the stools. Remember one point, these are the drugs, digestants are the drugs which are not get absorbed. Okay, digestants are not absorbed, they act locally in the GIT tract and which will be eliminated by the stool. And what is the major drawback with these digestant drugs? It causes the diarrhea. Diarrhea is one of the major drawback with the digestant drugs, abdominal cramping and nausea. Okay, diarrhea, abdominal cramping and nausea, these are the basic adverse drug reactions with the digestants. Okay. And the next one is carbonatives. So, carbonatives are the drugs which use it to treat the expulsion of gases. To treat the expulsion of gases, you can use the carbonatives. Carbonatives are drugs which will promote the expulsion of gases. By taking of these carbonatives, what the drugs will do here, this will expel the it will promote the expulsion of gases. So, what are the carbonatives you can use here? The drugs used as a carbonative, sodium bicarbonate. Sodium bicarbonate is a drug which is used as a carbonative. In which dose? 0.6 to 1.5 grams. In such a dose, the sodium bicarbonate will act as a carbonative. Next one, peppermint oil. Peppermint oil is also a carbonative drug. In which dose it acts as a carbonative drug? 0.06 to 1 ml of a dose it acts as a carbonative drug. Next, tincture of cardamom. Tincture of cardamom, if you are given 1 to 2 ml of tincture of cardamom, it can act as a carbonative. And last one, tincture of ginger. 0.6 to 1 ml of tincture of ginger can act as a carbonative. So, these are all the drugs which are used to expel or to promote the expel of gases. So, what are the carbonatives are using here? Sodium bicarbonate, peppermint oil, tincture cardamom and tincture ginger. In a respective doses, these drugs will act as a carbonative which will expel the gases. Next one, mode of action. What is the mode of action of carbonatives? If you see these drugs, it will shows its action by mild irritation. By the mild irritation, it will produces the mild irritation. This mild irritation will increases the GI motility. Remember this point, the carbonatives are the drugs which will shows its action by the irritation. Mild, this will the drugs, whenever you have taken these drugs, it can produces the mild irritation and it will leads to increases the GI motility. GI motility will be get increased. By increasing of GI motility, expulsion of gases from the stomach. Finally, it had shown its carbonative in action. Okay. Now, we will see the mode of action of some condiments and spices. These are the some spices like coriander, fennel, ginger, clove, black pepper, okay, cinnamon, ginger. All these are the spices which are used to expel the gases. How these are the agents will expel the gases? These are the agents will expel the gases by relieving the pain in the stomach and intestine. So, whenever you have taken the carbonative drugs, these will relieve the pain in the stomach and intestine. So, after taking of these drugs, any of these species like coriander, fennel, ginger, clove, cinnamon, black pepper, whatever it may be, whenever you have taken these drugs, it will relieve the pain in the stomach. By relieving of this pain, the expulsion of gases will be seen in the stomach. Finally, it acts as a carbonative. And what are the uses of an carminative? Carminatives are the drugs which are used as an flatulent dyspepsia. So, these are the drugs which can used as an flatulent dyspepsia, and these are the drugs which prevent the regurgitation of milk in infants. So, these are the drugs which can prevent the regurgitation of milk. Regurgitation, what is meant by regurgitation? Regurgitation means the flow of milk into the mouth. In such a condition, in such infants, you can use the carminative drugs. Okay. So, in this today lecture we had discussed about the appetite suppressants, digestants and carminative. Let me have a revision of these topics once again. So, if you see here, appetite suppressants are the drugs which are going to suppress the appetite. So, these are the drugs which are going to suppress the appetite. So, what is the necessity to take the appetite suppressant? Those people who having over in weight, some people will feel embarrassing if their weight has been increased. So, in such a condition they will take the appetite suppressant to decrease the appetite. So, by decreasing of this appetite, the decrease of food consumption is will seen. Then the particular person can reduces the weight very easily. But these drugs are not preferred because this can produce the toxic effects. Okay. So, there are some neuropeptides affecting energy balance. There are some foods like which can increases the food intakes. There are some substances, there are some drugs which can decreases the food intake. If I am talking about the food intake increasing, non-adrenaline, neuropeptide, opioids, cannabinoids, these are the drugs which will increases the intake of food. And there are such a drugs which will decreases the intake of food, serotonin, dopamine, okay, glucagon like peptides. These are the drugs which will decreases the intake of food. So, these are the drugs, so serotonin, dopamine agonist drugs, all these drugs can used as an appetite suppressants. So, what is these are the main classification of the drugs. Here we had seen the 4 types of drugs. What are the 4 types of drugs here? One is adrenergic agents, and second one is serotogenic agents, and third one is the agents acts both on adrenergic and serotogenic system, and finally cannabinoid receptor antagonists. So, these are the drugs falls under appetite suppressants. And after that we had discussed about the appetite suppressant drugs. There are some drugs which can causes the anorexia like antimicrobial drugs and anti-malarial, quinidine. Okay, if you are talking about digitalis, levodopa, metformin and this one anti-diabetic drug. Okay, metformin, it is an anti-diabetic drug, aminophylline, anti-asthmatic drug. All these drugs will increases the anorexia. It causes the loss of appetite. If you are taking any of these drug medication, these drugs will decreases the appetite. Okay, these are the drugs causes the anorexia. These are the drugs which causes the loss of appetite. So, limitations of anorexia. Limitation of anorexia, there are some drugs which are not being used because of its short term use, and if you are taking these drugs repeatedly which can causes the toxicity. So, if you are stopped this drug again, it can reverse the weight gain. And after of that we had discussed about the digestants. Digestants are the drugs which can increases the digestion. By how it will increases the digestion? It increases the digestion by the digestive juices. It can increases the digestants. So, in digestion we had discussed about the pepsin, renin, bile and bile acids, pancreatin, quinodeoxycholic acid, ursodeoxycholic acid. These are all the common digestants you use to treat the digestion. Okay, so these are all the digestant drugs. These are digestants are the drugs that claim to aid the digestion in the gastrointestinal tract. So, what are the drugs you can use as an digestants? What are the drugs you can use as an digestants? What are the enzymes you can use as an digestants? Renin, pepsin, bile and bile acids, pancreatin, quinodeoxycholic acid, ursodeoxycholic acid, all these drugs can be used as an digestants. Fine. And after of that we had discussed about the individual drugs like pepsin, renin, what are the uses of these drugs, from where it has been obtained and which dose it has been taken. Okay. And after of that we had discussed about the pancreatin. So, what from where it has been obtained, okay, and which enzymes are present on the pancreatin, amylase, tryptase, lipase, okay, and this is given in a coated form to prevent the gastric inactivation. right. And after that we had discussed about the bile and bile acids, and last we had discussed about the quinocholic acid and quinodeoxycholic acid and ursodeoxycholic acid. The ursodeoxycholic acid is used nowadays because it is an analog of CDCA. CDCA having the minor side effects like diarrhea, and it will increases the LDL levels in the blood. Okay. So, these are the common side effects with the digestants, and after that we had discussed about the carbonatives. Carbonatives are the drugs which will increases the expulsion of gases. So, these are all the carbonative drugs which will falls under the these are the carbonative drugs which will increases the expulsion of gases, and after that we had seen the mechanism of action, how it will increases the expulsion of gases, and this is the mechanism of action for the condiments and species, how it is going to increases the expulsion of gases. First it will relieve the pain in the stomach and intestine, finally the expulsion of gases will be seen in the stomach, and these are the uses. Flatulent dyspepsia and prevent the regurgitation. Regurgitation means the milk comes into the mouth, especially you can see in the infants. In such a condition you can use the carbonatives. Thank you. By this I had completed the digestants, carbonatives.